Did you know that 63% of nurses report feeling burned out due to understaffing and toxic work environments? And 1 in 3 nurses leave a job within the first 2 years because of poor management and unrealistic expectations. So, before you sign that contract, watch out for these 8 major red flags in your nursing job interview, okay? Because the wrong job can break you, but the right one can elevate your career. So let's get into it. We all know that job interviews for nurses can be nerve-wracking. I've done it, you've done it. But they're also your chance to assess the workplace and ensure it's the right fit for you. Some red flags can indicate poor management, burnout culture, or a toxic environment. Things you definitely want to avoid. Here are 8 major red flags to watch out for in a nursing job interview and how to handle them like a pro. We're going to handle them like a pro, for real, because we're tired, right? We're tired, ladies and gentlemen, for my male nurses out there. The first one is vague or evasive answers about staffing and workload. If you ask about a patient ratio or support staff and they answer is something like, we're a team, we just make it work. Or it varies, but we expect nurses to be flexible. That's a red flag. This likely means they're understaffing, burnout, and unsafe conditions. And how do you want to handle that, right? So you want to directly ask them at this point, what's the typical nurse staff to patient ratio or nurse to patient ratio on the unit? Do you use float nurses or agency nurses to cover shortages? If they avoid answering or say it depends, they may be overworking their nurses. So red flag number 2, high turnover or desperate to hire. If they say, we've had a lot of turnover, but we're making changes or rush to offer you the job on the spot, they might be struggling to keep staff due to poor working conditions or leadership issues. So how you want to handle this is by asking directly, can you share why the last nurse in this position left? How long do nurses typically stay in this unit? If they dodge the question or blame past employees, it's a bad sign. Red flag number 3. If the interviewer badmouths previous employees, calling them lazy, entitled, or saying people just don't want to work anymore, this could indicate a toxic, unsupportive culture. How do you want to handle that, right? How are you going to handle that? Well, you're going to ask them directly how leadership supports staff when they face challenges. What kind of team dynamic do you encourage? These are relevant questions. If they continue to speak negatively, you might be their next target. Number 4 is growth or education support. If there's no mention of career development, certifications, or tuition reimbursement, this may indicate a dead-end job with no room for professional growth. And I'm sure we've been in a few of those, right? So what kind of questions can we ask? So what we want to ask is, do you offer tuition reimbursement or support for specialty certifications? We just want to be direct. Are there leadership or advancement opportunities for nurses on this unit? If they say, we don't really do that, or you'd have to leave the unit for that, this may not be the best fit for long term if you're looking for an opportunity to advance. The next one is if they reschedule multiple times, they seem unprepared, or have no clear agenda, it may indicate poor management, and poor management equals workplace chaos. If you notice this and they reschedule once, you want to be flexible, right? Because things happen. If it happens more than twice, that's a red flag. If they seem disorganized, observe their body language and professionalism. This often reflects how they treat their nurses. Don't let this red flag get by you. Number 6 is if they say things like, our nurses stay late when needed, it's just part of the job. We expect dedication, even if that means answering calls on your days off. This is a setup for burnout, clearly, right? But sometimes when we're desperate, we kind of let them slide and think, we'll be able to work through it. But what you want to do is ask, how do you manage nurse overtime and work-life balance? Do you have policies on mandatory overtime or on-call shifts? If they seem vague or dismissive, you can expect long hours with no extra pay. Not cool. And number 7, if they expect you to handle an unmanageable number of patients without extra support or enough support, that's a huge red flag for patient safety and nurse burnout. So how would you handle that? Like, what's the best way to handle that? What you want to do is you want to ask them what the average patient load per nurse on the unit is. Do they follow state mandated nurse to patient ratios if there are state mandated nurse to patient ratios, which means you need to know that, right? But if they brush off your concerns or say ratios don't matter, think twice before accepting, because this is a setup for burnout. Now, all right. So this next one, number 8, if they expect you to jump in with no formal orientation, especially as a new nurse or in a new specialty, this could set you up for failure and liability issues. So what you want to do is ask them, what does the training period look like for this role? Is there a mentorship program or preceptorship for new hires? If they say, we expect you to learn as you go, this job may not support your success. Now, this is going to depend on your level of expertise. So you need to know yourself, because jumping into a new specialty is no joke. So a job interview is not just about them picking you. It's about you choosing the right workplace for you. If multiple red flags show up, trust your instincts. Your skills are valuable and you deserve a workplace that respects and supports you. And what I want you to do now is let me know, what are some of the red flags that you've noticed in nursing interviews, and drop me a comment down below and let me know, because we're all here to help each other hustle smarter and not harder. And not being burned out starts from the interview, because when we are super anxious to just take a job, or they are super anxious to just bring us in because we need the money or we want to work, we're anxious, we're new grads, this is what leads to us being burned out or taking advantage of. It's like anywhere else in your life. If you do not vet the right prospect to marry you, if you do not vet the right prospect to be your friend, you're going to end up with cross boundaries. And that's a lot of what's happening in nursing now. So ask the relevant questions. If you need to, watch this again so you can hear all the questions that I mentioned. And I hope these 8 red flags that I mentioned help you decrease the amount of burnout that you experience as you take off in your nursing career. I will see you in the next video. Let's keep hustling smarter and not harder.